Hi, I'm here today with Dr. Nikki Gentile. Dr. Gentile is an assistant professor at the University of Washington in the departments of family medicine and laboratory medicine and pathology. She's also the primary care medical director of the University of Washington Post-COVID Rehabilitation and Recovery Clinic. So thank you, Dr. Gentile, for joining us today.
Thanks for inviting me, Chris.
So first question, we've had COVID now in the world for about 3 years. Seems we're hearing a little less about it in the news. Seems maybe fewer people are getting it. Is COVID still a big deal?
Short answer is yes. And I'll just start by saying, based on the World Health Organization data, just looking from across the entire pandemic, we're talking about over 774 million cases of COVID, and over 103 million cases just in the US alone. CDC still tracks weekly indicators, and I think the most recent indicators we have is actually for January 20th to 27th. So we don't have anything, in the last week or so. But from January 20th to 27th, we still showed a 6.3% test positivity. The reason that's important is because if a test positivity of greater than 5% in general means that we're not in a controlled setting and there's a high risk of transmission of COVID. So thinking of wearing masks more and meeting people outside or avoiding areas where there's a lot of people in an enclosed space. So taking extra precautions in order to prevent transmission. Some other indicators for the January 20th to 27th week, we saw over 22,000 hospitalizations, for specifically for admission for COVID. And then 3.6% of all deaths in the US were attributed to COVID just during that week.
Okay, so it would
Yeah.
be premature to say COVID is no longer something we must consider on a regular basis. I'm glad you brought up masks. When would you currently recommend wearing a mask, and when do you think it's okay to forego wearing one?
Um, I do definitely think this is a little bit dependent on the situation. I mean, for people who are immunosuppressed setting, it may be best to mask if you have a normal immune system, for example, and maybe the test positivity rate is under 5%. You could think of not masking in public places as often, but that there's still a risk, obviously, because some people who have COVID may not know they have symptoms. And so it's really someone's choice, but I would absolutely say that if someone is sick with symptoms, they should be masking or not be out, period.
Okay, good,
Yeah.
good. How good would you say recent vaccines are for COVID?
Yeah, I think so. I'll make the blanket statement here that vaccination still remains the best protection against COVID related hospitalization and death. Really, the effectiveness studies for vaccines really depend on the population study, the study design, and the outcome you're looking at. And that includes rate of infection, emergency room visits, hospitalization, death. It also depends on vaccines that you're looking at, whatever vaccine's being studied. And I'll I'll kind of take us through a timeline, I guess, from the beginning of the pandemic. So, the original COVID vaccine was a monovalent vaccine. That's because we only had one strain of the virus that we had to worry about. So, mono meaning one. So, one strain that it protected us against. And it was, based on systematic review, which a systematic review is really one of the, it takes into account a number of randomized controlled trials and kind of does a summary. And so there's a nice systematic review that was actually published not too long ago, within the last few months, on 11 randomized controlled trials, which are the best trials when you're looking at new treatments and vaccines and whatnot. that showed for the original vaccines in studies that were done and published in 2021, the overall efficacy of all types of vaccines combined was 83%
Okay,
against the
so
occurrence of
not
COVID.
perfect, but pretty good.
Very, very good. And we know that it decreased risk of death, which was a big indicator then, and something people were really concerned about. So walking through the timeline a little bit, then we get to the 2022-2023 bivalent vaccine season. And that was, you know, I guess it was just a little over a year ago, maybe 15, 18 months ago when we were talking about this one. And bivalent meaning two. So this vaccine protected us against Omicron variants as well as the original strain. These vaccines were also quite effective, including up to 80% protection in children against urgent care and emergency room visits, which was really important to parents. Um, and I do want to mention that vaccine effectiveness decreases over time, which is why we have booster shots.
Hmm.
And now, and I guess I should say, for example, um, we'll use the bivalent vaccine from the 2022-2023 period as the example. So when looking at that one specifically and against hospitalizations, so that was our outcome, hospitalizations, was 62% effective during the first 7 to 59 days after vaccine, but only 24% effective at 120 to 179 days after vaccine.
Okay.
So this is why we have boosters. Or, we have a whole new vaccine now. So unlike the bivalent shots from previous years, the latest vaccine is a monovalent vaccine, and that's the one that is out currently. And some people in the media might hear Spikevax, for example. That's one of them, but there's several. These are designed again to protect against just one variant. And by one variant, I should really say variants have families, so it keeps mutating, and so while the one that currently was created was made in the fall, it's still shown to be effective against what strains out there now. And I should say that this is based on exciting new data that was actually published only a few days ago on early vaccine effectiveness estimates in adults with normal immune systems. It showed that receipt of the updated vaccine for this year provided approximately 54% increased protection against symptomatic infection with those who didn't have the vaccine. So that's actually a big deal, and it's in line with the flu shot every year. And
Good.
and it did show that it would protect it against the current variant out there.
Good. And do you think the CDC recommendation is going to evolve into a once a year booster formula?
Yeah. So right now, the current guidance really only mentioned get the vaccine now for this year. And, but given that the virus that causes COVID-19 is always changing, and like I'd mentioned, the effectiveness wanes over time, receiving an updated vaccine every year very well might be what is recommended in order to restore protection and provide the enhanced protection against variants that are new.
Now on to long COVID. And first, what is long COVID?
It's a great question. I'll give the easy answer first, and that is that it's a broadly defined term, encompassing symptoms that really linger for weeks, months, or even years after COVID-19 illness caused by the SARS-CoV-2 virus. And I make that statement because people might actually read out there SARS-CoV-2 or COVID. COVID-19 is the illness that the virus SARS-CoV-2 causes. So prolonged symptoms after an infection.
Okay.
Some people recover and then might notice symptoms return and then linger, and that still is classified under that umbrella term of long COVID.
And what are the most common symptoms of long COVID?
There's been over 200 symptoms that have been reported, but some of the more common ones are fatigue, shortness of breath, elevated heart rate, difficulty sleeping, post-exertional malaise, um, uh, smell and taste issues.
Okay, so a wide variety.
Yeah, really a
Suppose
wide variety.
suppose I'm a little tired and I want to know, or I'm a little spacey, and I want to know if I have long COVID or it's just normal spaciness or fatigue. Is there a way I can tell the difference?
Um, well, unfortunately, we don't have one single test to identify long COVID.
Mhm.
In many instances, we will rule out other conditions, or I should say that in that process, just because there might be some other diagnosis like diabetes, it doesn't necessarily mean that long
Mhm.
COVID is excluded. And I think that
Mhm.
that's important to mention. Um, but it is important to make sure that if somebody had diabetes that was well controlled before they had the virus, that they get they get checked to see if their diabetes is no longer controlled, because that can happen. I've also seen new cases of sleep apnea that people didn't know they had, or it
Mhm.
was new since having COVID. I've seen cases of iron deficiency quite commonly. Um, and so it's always good if there's a history of COVID and someone's experiencing any new symptoms or continued symptoms for months after the infection, that they see their doctor and have a discussion about it.
Okay, so it sounds
Because it
not a
could be,
super simple diagnosis.
no.
How common or how rare is it after COVID to develop long COVID?
So that is also a really good question. According to current public health models, I'm going to use world data for this. So over 773 million cases of COVID, um, assuming 10% of people get long COVID, which is one of the numbers cited in the literature. I've seen higher numbers as well, but
Mhm.
10% is kind of what we're saying now. That's 73. That's over 77 million people living in the world with long COVID. And I would say that the breakdown based on some of these models is 10 to 30% of non-hospitalized cases, 50 to 70% of hospitalized cases, and 10 to 12% of vaccinated cases. So vaccines are key here.
I was just going to say, given that it's common and that vaccination brings down the risk of getting COVID in the first place, and you have to have ordinary COVID before you get long COVID, one way to
Mhm.
bring down the risk of long COVID is just get the simple vaccine in the first place before you're ill.
Yes, yes, absolutely.
Okay.
hmm
Now, suppose you've been diagnosed with long COVID. What is treatment?
Another great question. So there's unfortunately, no one specific treatment, no blanket treatment that can tackle long COVID altogether. But we do have many effective treatment strategies already in place, and patients are getting better, so there is hope. Um, I would say that all patients present differently and experiencing varying impacts on quality of life and function. So it's important to have an individualized treatment plan that takes into account treatment goals for the patient and conversations regularly with their doctors.
Okay, so really treatment depends on the specific way in which it presents and what your symptoms are.
Yes, and I would say that it is a relapsing and remitting condition. And so there are various triggers. For somebody, it might be a certain food or type of food that is triggering. For someone else, it might be traveling. For someone else, it might be a cognitive load or work stress.
Okay.
And I'll use a big example that often is missed, even in the medical field, is that the work stress is a common trigger for post-exertional malaise. And
Mm,
this cannot be missed
mm.
because everybody needs time to recover and work accommodations are important.
Okay, good to know. Now, we mentioned vaccination as a way of bringing down your risk of long COVID. Are there other strategies that could bring down your risk of developing that?
Best way to prevent long COVID is by not getting COVID, like you said. But I do want to also mention with that, there's a cumulative risk of long COVID. The risk increases with multiple infections. So if
Mhm.
somebody is infected with COVID 4 times, their risk is higher based on studies at this time. Other things I would mention, if you're sick, test. And if it's negative, retest and then retest again, because later strains actually, and particularly if someone's vaccinated, may not have as high of a viral load. The first test may not be positive. And so serial testing, meaning testing within 24 hours of prior test, just to make sure that it's negative. I've seen people pop up positive on day 5.
Okay.
Um, yeah. And then get treatment. You might be eligible for treatment. Not everybody is eligible, but it's important to contact your doctor and see if you are eligible and ask for treatment. And then, like I'd mentioned before, choosing outdoor activities over indoor activities, washing hands often, avoiding close contact with others, wearing a mask in public places, stay home if you're sick.
Got it. What's the
Yeah.
easiest way to get your hands on a test kit?
Well, the government still is giving out the free tests.
Free.
Yep. So I don't have the website offhand, but you can order 4 free tests through them. Also, they're still over the counter, so you
Okay.
can buy them. And
Good.
Amazon has them too.
Good. Excellent. Any other things we should touch on before I let you go today?
The only other thing that I would mention, just because I think it's important to realize with the environment of long COVID right now, is that there are many terms out there for long COVID. Long COVID is really the publicly defined term. And other names people might hear is long haul COVID, post COVID conditions, chronic COVID, post acute sequelae of COVID-19. These are all names that are out there in the literature and in the public. And there's really no clear definition of long COVID right now. Like I had mentioned, it's an umbrella term,
Mhm.
really for multiple conditions, how we think about it. And the National Academy of Science, Engineering, and Medicine convened the committee on examining the working definition for long COVID. And so that definition is going to be changing and hopefully will be encompassing a bit more specific, like phenotypes and timeline. And so it'll be a little more clear in the future what that definition is. But more work needs to be done on that. So right now, long COVID is long COVID as we know it, but just keeping in mind that that might change. And I also do think it's important to mention that there are racial and ethnic disparities that need to be considered. Um, and that's really important as well.
Okay, good. Good. Well, it sounds like a new illness that we're still learning a lot about in a hurry.
Yes.
All
Yes,
right.
it is. More to come.
Dr. Nikki Gentile, University of Washington, thanks much for talking with me today.
Thank you, Chris.